Diabetes mellitus, or simply diabetes, is a chronic condition that affects how your body processes glucose, also known as blood sugar. Glucose is a key source of energy for the body's cells, and insulin, a hormone produced by the pancreas, helps regulate it by promoting absorption of glucose by cells for usage. In type 2 diabetes, the body's cells become resistant to insulin. This is called insulin resistance, which means they don't respond to it as they should. Since glucose isn't properly absorbed by the cells, it builds up in the bloodstream, leading to high blood sugar levels or hyperglycemia. This progression can happen slowly over years, often without noticeable symptoms, which is why many people don't realize they have type 2 diabetes until complications arise. Increased thirst and frequent urination, polydipsia and polyuria. When blood sugar levels are high, the kidneys attempt to remove the excess glucose by filtering it out into the urine. This process draws water along with it, leading to increased urination, polyuria. The loss of water triggers dehydration, which makes you feel more thirsty, polydipsia, as your body signals you to replace the lost fluids. Fatigue and feeling constantly tired. Cells in the body rely on glucose for energy. In type 2 diabetes, insulin resistance prevents glucose from entering the cells effectively. As a result, the cells are starved of energy, leading to persistent fatigue despite adequate food intake. Unexplained weight loss. When cells cannot absorb glucose due to insulin resistance, the body starts breaking down fat and muscle for energy. This leads to catabolism and unintentional weight loss, even if a person is eating normally or more than usual. Certain factors increase your risk of developing type 2 diabetes, including being overweight or obese, especially with excess fat around the abdomen, leading a sedentary lifestyle with little to no physical activity, having a family history of type 2 diabetes, being over the age of 45, having conditions like high blood pressure, high cholesterol, or polycystic ovary syndrome, PCOS. Prolonged, uncontrolled type 2 diabetes primarily affects blood vessels. It will damage the blood vessel walls, leading to poor circulation and slow wound healing. These complications are divided into two categories, macrovascular and microvascular. Macrovascular complications. These affect the large blood vessels. They include heart disease. People with diabetes have a higher risk of developing coronary artery disease, which can lead to heart attacks. Stroke. Diabetes increases the likelihood of blockages in the blood vessels that supply the brain, leading to strokes. Peripheral artery disease. Reduced blood flow to the legs and feet due to narrowed arteries, which can cause pain, ulcers, and even lead to amputations. Microvascular complications. These affect the small blood vessels. They include diabetic retinopathy, damage to the tiny blood vessels in the retina, which can lead to vision problems and even blindness if untreated. Diabetic nephropathy, damage to the kidney's filtering units, causing protein leakage in the urine and eventually kidney failure. Diabetic neuropathy, nerve damage due to poor blood supply, leading to symptoms like pain, tingling, or numbness in the hands and feet. Severe cases can result in loss of sensation, increasing the risk of injuries and infections. Type 2 diabetes is diagnosed with blood tests, including 1. Fasting blood sugar test, measures blood sugar after an overnight fast. 2. HbA1c test, reflects your average blood sugar over the past 2 to 3 months. An HbA1c of 6.5% or higher is a sign of diabetes. 3. Oral glucose tolerance test, measures your body's response to sugar. 4. Random blood sugar test, measures blood sugar level at any time. The key to managing type 2 diabetes is maintaining healthy blood sugar levels. Here's how. 1. Lifestyle changes. Healthy eating. Focus on a balanced diet rich in whole grains, vegetables, lean protein, and healthy fats. Avoid sugary and processed foods. Regular exercise. Aim for at least 150 minutes of moderate activity per week, like walking, cycling, or swimming. Weight management. Losing even a small amount of weight can improve blood sugar control. 2. Medications. Your doctor may prescribe oral medications like metformin, or in some cases, injectable medications or insulin. 3. Monitoring blood sugar. Regularly check your blood sugar levels at home to understand how your body responds to food, exercise, and medications. 4. Regular doctor visits. Routine checkups are important to monitor your blood sugar, blood pressure, and cholesterol levels. Living with type 2 diabetes doesn't mean giving up your quality of life. With proper management, you can enjoy the things you love while staying healthy. Education, support, and staying proactive are key.